Mental illness is one of the biggest problems of our time. It impacts on productivity, educational outcomes, physical health, and for many people, it can lead to death.
Around 1 in 5 Australian adults experience a mental health condition in any given year. This can really impact on their self-esteem, their social relationships, and just general well-being.
Most people have some level of empathy, or a lot, with people who have anxiety and depression, because we all get anxious or depressed. But people who have bipolar disorder or schizophrenia, it's harder for the community to understand that.
It's really, really hard to actually estimate the total costs mental illness has to the society, because they're huge, they're immense. No one could possibly ever really calculate the true costs. So if we can really tackle mental illness, then we could have immense cost savings, and I think this will increase our productivity and growth of our nation.
The number of people who kill themselves in the last year exceeded all the number of deaths associated with road accidents, drug overdoses, and HIV. We also know that suicide is now the biggest killer of young people between 15 to 25 and 25 to 44.
Concerningly, around 1 in 7 Australian children also experience a mental health condition. And this can range from things from difficulties with attachment or anxiety and depression.
Everybody has either experienced a mental illness or knows someone with a mental illness. It's as common as the flu. That experience means that it's easier, not easy, but easier to talk about it.
There has been a greater ability to talk about mental illness in the community. It's no longer nearly as stigmatized. And I think that really normalizes and enables people to realize that this is a problem that a very significant proportion of Australians experience. But we don't want to engage in disease mongering. So it's very important to put it into perspective. Reports that are coming through and have been coming through for many, many years have provided a sufficient trigger for both the Commonwealth Government and the state government and state and government territories around Australia to pay much closer attention to the problem. About 4.8 million Australians have some form of mental illness, and the majority of that are high prevalence disorders like anxiety and depression. 3% have what's described as severe mental illness, something like 750,000 people. And they include schizophrenia, bipolar disorder, and severe depression.
In the past 10 years, we've been talking about mental health, but in these conversations, we've not really differentiated mental health, mental well-being, and mental illness. What this means is that when we are talking about poor mental health, people often associate that with mental disorders and mental illness, which is a category on its own that needs specific sort of treatments. And therefore, the discussion around mental health and mental well-being is also stigmatized, which in itself is a problem.
Teachers have a great opportunity to be able to identify kids who have mental health issues. Unfortunately, they don't have a lot of time, many of them, or the resources, and so they need a lot more support in also helping these kids. But the bottom line is that it's everybody's business, including teachers, to be able to support young people's mental health.
Early intervention is really crucial, and if we're not picking up on these mental health conditions or other prevalent disorders that we see in childhood, such as ADHD, then it can have a really detrimental and cascading impact on the child's development and their ability to form and maintain social relationships.
The Turner Institute for Brain and Mental Health was officially opened this year in July.
And it represents a body of researchers and clinicians whose mission is to really build communities that are developing healthy mental health. The overriding goal of the Turner is to work with our communities around us. So it's to work in the Southeast Corridor where there is a massive area of unmet need, and it's to develop interventions that will be able to have an impact on the communities around us, whether it's remote communities or whether it's going all the way through to people in Clayton that really need, resources that will promote early and good mental health.
We're developing training interventions that are supporting and strengthening cognitive skills in early childhood. So we know that cognitive skills are really important for supporting both emotional and behavioural regulation, as well as supporting learning and social relationships. Digital technology has a lot of potential to create engaging tools that can be tailored to children. So we've created an attention training program which is called Tali Train, and it involves a series of exercises that are tapping core aspects of attention. And children repeat these over a period of time, so we're really strengthening and building those connections within the brain.
Over the next year, we'll be rolling out a new program with our partners from Harvard to look at how students can monitor their well-being and their mental health using a digital phone, and see if we can use these technologies to improve mental health well-being, across different types of populations.
There's many potential negative impacts of technology if it's used poorly. If it's used well, it can be a really good servant in your life, but for many it's becoming a bit of a tyrannical master. The over-reliance on social media is associated with poorer mental health and higher narcissism. Like any addiction, it starts to replace other things. So pretty soon people aren't actually meeting and connecting with others, they're connecting via a very small screen. So there's a kind of disconnect, there's a kind of social isolation that comes with that.
We've got psychological interventions, we've got social interventions, we've got treatments that can treat symptoms and make people feel a bit better. All of these treatments are partial treatments, none of them actually fix the problem, and we don't know what the underlying pathology is that's in the brain that causes these illnesses. The brain is very inaccessible, and so you can't subject people with mental illness to the same types of tests and scrutiny that you can to cancer.
A large number of pharmaceutical companies have essentially stopped their research in the field of psychiatric disorders. They don't see it as particularly commercially viable when compared to treatments for cancer or infectious diseases, for example. Part of the problem with the stigma around mental health disorders is it goes to the very fact that we can essentially have our personalities affected. So it's of paramount importance to us that we change the paradigm in the way that we think about developing new therapeutics in the schizophrenia space, addiction space, other psychiatric disorders.
It's not just having that quick medication, that quick pill that you think will then just make you really happy. It takes effort, and it takes you going out of your comfort zone to actually build the blocks that you need in your life that will help you sustain good mental health.
So mindfulness is a pretty simple thing of just being present in your day-to-day life. It really involves two things, attention and attitude. Mindfulness, for example, could be one very simple thing that can have a profound effect, but it requires work and effort. You have to put in the hard yards, as it were. So to actually pay attention when you're at the meeting, to pay attention when you're driving your car, to just taste the food when you're eating, just to give yourself a mental break. It's profoundly important for mental and physical health.
Over the last decade, last 15 years, there's been a really major change in the way society has reacted to mental disorders. There's been much more in the way of community leaders, famous people, important people admitting to, acknowledging that they've got mental illness.
It's been tremendous to see that many elite athletes who have struggled with issues, and to have the courage to be able to speak about it and to be a role model and example. I was very happy one day when the Richmond club psychologist came to some mindfulness training I was running for the Australian Psychological Society. I said, if you want to bring it in, it's got to be more than just a little 5-minute diversion from time to time, do some meditation. It needs to be part of the culture. And they really picked it up and ran with it. And over the last few years, they've done an absolutely wonderful job with it. They've really built a strong, connected culture. It's really a wonderful example.
I think we have to convince employers to invest in the mental health of their workforce, because we know working while sick but being unproductive has immense costs to Australian employers. It's estimated around 13 billion per year.
Everybody agrees on the importance of these things, but in the workplace there has been no systematic way to introduce policies, to evaluate them, and to basically have a holistic approach to understanding workplace health and well-being.
We have one of the best physical health systems in the world, but then we have tagged on to this physical health system a mental health system.
The Victorian Auditor General handed down its report, and it showed that there were major problems. There's been a dramatic increase in emergency department presentations of people with mental illness. More than 50% who are going to be admitted have to wait more than 8 hours. And the number of days that people are able to stay in wards and be treated has gone down. People are being discharged from hospital much too early, and that's because there just aren't enough beds. We need to be forward-looking. There needs to be economies of scale. There needs to be an aggregation of expertise. We can do so much better.
I think we are now ready as a community, as a society, to take the next step, to be able to say, okay, well, we've educated people a little bit, we've destigmatised a little bit, let's, as a community, as a society, dedicate ourselves to achieving the sorts of advances that will ultimately lead to the prevention and the cure of these disorders.